Welcome friends, I'm Dr. Rajsree Nambudripad, and today's video is all about the powerful role of digestive enzymes and stomach acid. One of the biggest problems I see in my practice is incomplete digestion of food. Due to a number of factors, some people are not making enough digestive enzymes or stomach acid, and this can lead to a whole host of symptoms. Some of the symptoms are within the GI tract, and some are systemic. This is why correcting your digestive enzymes and stomach acid can really transform your health, because how you digest your food impacts nutrient absorption and inflammation levels, and it sets the stage for your overall health. In today's video, we're going to dive deep, and we're going to talk about the dynamic interplay between the key organs in our body to properly digest food. This begins in our mouth with saliva, followed by our stomach, pancreas, liver, and gallbladder. And finally, there's something that people often overlook, which are the brush border enzymes in our small intestine. Then I'm going to explain how you can easily treat these conditions by supplementing with digestive enzymes and betaine and pepsin. Let's begin by reviewing the symptoms of low digestive enzymes and low stomach acid. If you're not making enough digestive enzymes or stomach acid to properly break down your food, this can lead to symptoms like bloating, belching, and excessive gas. It can also cause non-acid reflux as well as LPR, which is laryngopharyngeal reflux, also known as silent reflux, and it affects the larynx in your throat. You may also notice phlegm in the throat, which can lead to frequent throat clearing. Additional symptoms include frequent loose stools with urgency, where you may feel afraid to leave the house. You may also notice undigested food fragments in the stool, or floating stools because of the undigested fat. Sometimes you may also notice oily stools, which we call steatorrhea. Some symptoms of low stomach acid include early satiety and feeling full for an extended period of time. You may even feel an aversion towards eating foods high in protein, such as meat, chicken, or eggs. And that's because you need stomach acid to properly digest proteins. We can also see symptoms of malabsorption, like weight loss and vitamin deficiencies. Fat-soluble vitamins include vitamins A, D, E, and K. For example, if you're supplementing with vitamin D, but your level is not going up on your labs, this could be a clue that you have a problem absorbing nutrients from your food. We may also see deficiencies in iron and B12. A lot of patients with low stomach acid and low digestive enzymes are simply told they have IBS, which is a really vague diagnosis because it doesn't explain what's actually causing the symptoms. Or they're mistakenly told they have acid reflux, when it's actually non-acid reflux, and it's the undigested food that's actually coming back up the esophagus. Inadequate enzymes and stomach acid can also have other far-reaching consequences on your health, so let's go over these. Normally, our stomach acid and digestive enzymes help prevent the overgrowth of bad bacteria and yeast in our gut microbiome. So having low stomach acid and low digestive enzymes is a risk factor for developing small intestine bacterial overgrowth, also known as SIBO. So normally, our small intestine does not have a lot of bacteria, and most of the bacteria are located in the large intestine or colon. The job of the small intestine is to absorb nutrients from our food. But when there's low stomach acid or low digestive enzymes, this can lead to small intestine bacterial overgrowth. So patients with SIBO feel bloated every time they eat, and they also have alterations in their bowel habits. So this is why correcting the digestive enzymes and stomach acid is a big part of treating SIBO. And if you'd like to learn more about it, please check out my video, which covers my herbal protocol for treating SIBO. Another consequence of low digestive enzymes and low stomach acid is dysbiosis. So dysbiosis is an imbalance in the gut microbiome where bad bacteria or yeast start to overpopulate. And I have a whole video on dysbiosis where you can learn more about this topic. And next, it can lead to fungal overgrowth in the gut microbiome, like Candida or SIFO. So SIFO is small intestine fungal overgrowth, so it's the fungal version of SIBO. And that's because without proper stomach acid, yeast and fungal microorganisms can overpopulate in the microbiome. And to learn more about this fascinating topic, please check out my video on Candida and SIFO. Next, not digesting your food properly can lead to inflammation, and this can present in many ways. For example, it can cause joint pain, brain fog, fatigue, or even weight gain. I can't tell you how many times I've had patients tell me that since supplementing with digestive enzymes, not only did their bloating go away, but their joint pain also went away. And for a more in-depth review on inflammation, please check out my video, which goes into great detail. Did you know that incomplete digestion of food can also flare up autoimmune diseases like Hashimoto's, rheumatoid arthritis, lupus, or psoriasis? So in autoimmune diseases, the immune system gets confused and starts attacking your own tissues. And undigested food particles can actually confuse the immune system. And that's because 70% of our immune cells are in the lining of our gut. Also, a lot of people with autoimmune disease suffer from increased intestinal permeability, also known as leaky gut. In leaky gut, there's disruption in the intestinal barrier, so these undigested food fragments can readily enter the bloodstream and register as foreign threats to the immune system, which can flare up the autoimmune process. So if you'd like to learn more about autoimmune disease and how you can treat it using a holistic approach, please check out my video on this topic. Now let's review what are the risk factors for developing low digestive enzymes or low stomach acid. One big risk factor is an H. pylori infection. H. pylori is a bacteria that infects your stomach and produces an enzyme called urease that neutralizes stomach acid. So if you have an H. pylori infection, you definitely want to treat it. And if you're looking for a natural protocol for treating H. pylori, please check out my video on this topic. Next, if you get a parasite infection, this can lead to inflammation throughout your intestines that can affect your pancreas's ability to produce enzymes. Now, if you've had food poisoning and this led to IBS, which we call post-infectious IBS, this can also affect your pancreatic enzymes. Hypothyroidism or low thyroid is another root cause of low stomach acid. Celiac disease, an autoimmune condition where the body reacts to the protein gluten, which is present in wheat, barley, and rye, can also affect the production of pancreatic enzymes. Crohn's disease, which is an autoimmune condition affecting the GI tract, has also been associated with pancreatic insufficiency. Chronic pancreatitis, which is inflammation in the pancreas caused by heavy alcohol use or gallstones, can also affect the pancreas's ability to produce enzymes. And finally, we have stress, because stress can really affect the vagus nerve, which I'm going to talk more about later in this video. And the vagus nerve strongly influences our production of stomach acid and digestive enzymes. Now let's review the three main macronutrients and how we break them down. The three main macronutrients that we need to break down are carbohydrates, proteins, and fats. Carbohydrates like bread are broken down into disaccharides, which are two sugar molecules linked together. Then they're broken down into monosaccharides, which are single sugar molecules. Proteins like meat are broken down into amino acids. And fats, like oils and avocados, are broken down into glycerol and fatty acids. Now let's take a closer look to understand exactly where each of these macronutrients are broken down. Carbohydrates like bread, fruit, and grains like oatmeal are broken down by an enzyme called amylase. And there's two types of amylase. One is made by our saliva in our mouth, and the other is made by our pancreas. Amylase can help break down long polysaccharides found in starches into disaccharides, which are two sugar molecules linked together. Then eventually, brush border enzymes in our small intestine break these down into single sugar molecules called monosaccharides, which can be absorbed. Unfortunately, in SIBO, the bacteria eat up the brush border enzymes. And without these enzymes, it's hard to fully digest carbohydrates, which can lead to numerous carbohydrate intolerances. This is why patients with SIBO feel like they're sensitive to a lot of foods. And the undigested disaccharides get fermented by the SIBO bacteria into gas. So this is why patients with SIBO feel bloated every time they eat. They also develop secondary lactose intolerance as well as fructose intolerance because the SIBO bacteria start fermenting the lactose and fructose into painful gas. Once we treat SIBO, the brush border enzymes are restored and we see significant improvement in carbohydrate toleration in the diet. For example, they're able to tolerate fruits again. Now let's look at how we digest proteins. When you eat protein like chicken, meat, eggs, beans, or tofu, it's first broken down by the stomach, which produces hydrochloric acid and the enzyme pepsin. Next, the pancreas makes additional enzymes called proteases that also help break down proteins into amino acids. Moving on to the digestion of fats, there's actually two parts to fat digestion. If you're eating something fatty like avocado, nuts, or oils, it first has to get broken down by bile. In part 1 of fat digestion, the liver makes bile which is stored in the gallbladder. And when you eat, the gallbladder contracts, which releases the bile into the small intestine. Bile helps to emulsify fats into tiny molecules called micelles, which are easier to break down. Unfortunately, people who have had their gallbladder removed are unable to store up the bile, so their digestion of fats can be somewhat impaired, especially when eating a high-fat meal. Part 2 of fat digestion happens in the small intestine with the help of pancreatic enzymes called lipases. These break down fats into glycerol and fatty acids which can be absorbed. Now let's look more closely at each of the organs of digestion and review what can go wrong in each area. Once again, here are the main organs of digestion. So it begins in our mouth with saliva, followed by our stomach, pancreas, liver, and gallbladder, as well as the brush border enzymes in the small intestine. So let's look more closely at the stomach. As soon as food arrives in the stomach, the parietal cells begin producing hydrochloric acid. This is why our stomach juices are extremely acidic and have a pH under 2. Chief cells in our stomach produce an enzyme called pepsinogen. Pepsinogen is actually a precursor hormone and in the presence of stomach acid gets converted into pepsin, which is the active hormone. This strongly acidic environment and the combination of hydrochloric acid and pepsin is needed to digest foods, but especially proteins. If your stomach is not making enough hydrochloric acid, we call this hypochlorhydria, which is low stomach acid, or achlorhydria, which means the absence of stomach acid. Let me show you what happens without stomach acid. The pH of the stomach will be high and there will be no conversion of pepsinogen to pepsin, and food will not digest. Symptoms of low stomach acid are burping and bloating after meals and feeling like the food is not digesting for hours after the meal. It can also lead to an aversion to eating foods high in protein, like chicken, meat, or eggs. So what tells the parietal cells in our stomach to produce hydrochloric acid? Well, the parietal cells are stimulated by 3 things. First, by acetylcholine, which is released by the vagus nerve, which comes from your brain and controls the parasympathetic nervous system. Second, by the hormone gastrin, which is made by the stomach in response to food. And third, by histamine. Of these 3 signals, I want to emphasize the vagus nerve. As you'll see, the vagus nerve is huge when it comes to digestion. It signals not just the stomach, but also the pancreas and gallbladder, and it controls motility throughout your intestines. This is why eating your food in a relaxed atmosphere and really enjoying your food is essential to healthy digestion, because you want your vagus nerve to be fully activated to make optimal levels of stomach acid and digestive enzymes. Interestingly, coffee, both regular and decaffeinated varieties, stimulates stomach acid production. This is why for some people, coffee can be a trigger for acid reflux. Now, having healthy parietal cells in our stomach is also very important for vitamin B12 absorption. That's because the parietal cells secrete intrinsic factor, which binds to B12 and facilitates the absorption at the end of the small intestine, called the terminal ileum. Now let's talk about how the stomach strongly influences the pancreas. So the acidic chyme leaving the stomach is a strong trigger for pancreatic enzyme production. Remember, food leaving the stomach has a very acidic pH of 2. This stimulates the pancreas to secrete bicarbonate and enzymes to increase the pH to 6. This is why if you have low stomach acid, it can lead to a domino effect and impact your production of pancreatic enzymes as well. For example, if the pH of the chyme leaving your stomach is 5 because your stomach isn't producing much acid, then your pancreas won't be properly stimulated and it won't make as much bicarbonate or enzymes. This is why people with low stomach acid suffer from belching and significant bloating after meals, and they can feel full for hours after the meal because their food is not digesting properly. When we correct this problem by supplementing with betaine and pepsin, which I'm going to talk more about later in this video, it can be life-changing. Now let's talk about the pancreas. The pancreas is a unique organ because it has a dual role. It functions as an endocrine organ and produces hormones like insulin, and it also functions as an exocrine gland that produces enzymes. The endocrine and exocrine parts of the pancreas are actually interspersed and scattered together throughout the pancreas. Let's take a closer look. The cells labeled as the islets of Langerhans are the hormone-producing endocrine glands of the pancreas, and they contain beta cells which make insulin and alpha cells which make glucagon. The pink cells are the pancreatic acinar cells, which produce enzymes, and they're connected to the pancreatic ducts, which release the enzymes into the small intestine. Did you know that the pancreas secretes a liter of fluid every day, which is a combination of enzymes and bicarbonate? What's also fascinating is that the pancreas has the highest rate of protein synthesis of any organ in our body, and that's because pancreatic enzymes are proteins. So a liter of pancreatic juice can have anywhere from 10 to 100 grams of protein that's released into the small intestine every day. So what stimulates the pancreas? So once again, the acidic chyme arriving in the duodenum is one of the main triggers for the pancreas. Pancreatic acinar cells are stimulated by three things. First, we once again have the vagus nerve, which comes from the brain and produces acetylcholine, as well as hormones like CCK, which is cholecystokinin, and secretin, which are made by cells in the intestines. What's interesting is that pancreatic enzyme production can actually adapt to the diet. For example, those following a high-protein, low-carb diet, they will have higher levels of proteases and lower levels of amylase in their pancreatic juice. And these changes in pancreatic enzyme production are thought to be hormonally regulated at the level of gene expression. Now, if your pancreas does not make enough enzymes, we call this exocrine pancreatic insufficiency, or EPI. Now let's talk about the gallbladder. The liver produces bile, which gets stored in the gallbladder. Bile is made in the liver from cholesterol and bile acids. It's green because of pigments from bilirubin, which comes from the breakdown of red blood cells. When we eat, the gallbladder contracts and bile gets released into the duodenum, which is the first part of the small intestine. At the end of the small intestine, called the ileum, bile gets reabsorbed and returned to the liver, and we call this the enterohepatic recirculation of bile. Bile has a hydrophobic side, which is a water-fearing side, and a hydrophilic side, which is a water-loving side. This gives bile the special ability to break down fats into smaller particles called micelles. Remember, bile plays a big role in part 1 of fat digestion. So what stimulates the gallbladder? The gallbladder again is stimulated by the vagus nerve, which produces acetylcholine, as well as CCK, which is made in the small intestine, all in response to food. And bile can actually affect the color of our stools. As the green bile gets oxidized, it turns the stool brown. In the absence of bile, stools are actually clay-colored. So if you notice clay-colored stools, definitely talk to your doctor because this can be a red flag that something is wrong. Those without a gallbladder still make bile in their liver, but they don't have anywhere to store the bile, so their digestion of fats can be impaired, especially when eating a high-fat meal. This is also why we often see big improvement when they supplement with Digestive Enzyme Pro, which contains ox bile, and I'll be talking more about this treatment later in this video. Now let's talk about another vitally important source of digestive enzymes in our GI tract that's often overlooked. So we've already talked about the main organs of digestion, which are the stomach, pancreas, liver, and gallbladder. But there are critical enzymes that are present on a microscopic level on the microvilli, which are the tiny finger-like projections in our small intestine that help us to absorb nutrients from our food. So here's a picture of the microvilli under an electron microscope. The fuzzy coating at the edge of the microvilli is called the glycocalyx, and it's full of enzymes that are critical for carbohydrate digestion. When it comes to carbohydrates, there are multiple steps that are required to properly break down a long polysaccharide. First, the pancreas makes an enzyme called amylase, which breaks down the polysaccharide into disaccharides in the lumen of the small intestine. And then the disaccharides, which are two sugar molecules linked together, are broken down into monosaccharides, which are single sugar molecules by the brush border enzymes in the glycocalyx. To better understand this, let me give you some examples of the different types of carbohydrates. Starch and cellulose are examples of polysaccharides, and they're found in vegetables, whole grains, and legumes. Examples of disaccharides include sucrose, which is in table sugar, and it's made of one glucose molecule and one fructose molecule linked together. Lactose, the sugar present in dairy products, is glucose linked to galactose. And monosaccharides are single sugar molecules like glucose, fructose, and galactose. Now that we understand how important these brush border enzymes are for digestion, did you know that the SIBO bacteria do a terrible thing and they eat up these brush border enzymes? This is why having SIBO can lead to numerous food intolerances, especially carbohydrate intolerances. And that's because the final step of digestion at the level of the brush border enzymes is impaired. In addition, many pancreatic proteases, which are the enzymes that digest proteins, require an activation step by brush border enzymes. For example, the pancreas secretes trypsinogen, which is an inactive precursor enzyme that has to be converted by a brush border enzyme called enterokinase into trypsin, which is the active enzyme that can break down proteins. So as you can see, the absence of these brush border enzymes can lead to a domino effect, which can impact the digestion of carbohydrates, but also potentially impact the digestion of proteins as well. So how can we diagnose low digestive enzymes or low pancreatic enzymes? Well, most of the time, I can suspect the diagnosis based on a patient's symptoms. And then I'll recommend the treatment, which is really easy to try, to see if their symptoms improve. Now, if we do a stool microbiome test, there's also several clues that can be helpful. If you have elevated fecal fat, this could indicate problems with your gallbladder or pancreatic enzyme production. And if there's high fecal protein, this could indicate low stomach acid. We also look at pancreatic elastase, which is a marker of pancreatic enzyme production. So if your pancreatic elastase is low, this could indicate pancreatic insufficiency. The great news is that low digestive enzymes and low stomach acid are easily treatable conditions. So let's go over the treatment. Digestive Enzyme Pro is a strong and effective broad-spectrum enzyme, and it helps target the breakdown of proteins, fats, and carbohydrates. And it's been an absolute favorite among my patients and customers. So it contains pancreatin, which has protease to digest proteins, amylase to digest carbohydrates, and lipase to digest fats. It also contains ox bile to digest fats, betaine and pepsin to digest proteins, as well as bromelain from pineapple and papain from papaya, which also help to digest proteins. So you can take 1 to 2 capsules either before or after your meal, and I recommend trying it both ways to see which works best for you. We also have a vegetarian version if you prefer. If you take Digestive Enzyme Pro in advance of the meal, like 5 to 30 minutes before the meal, this allows your stomach to open up the capsule to prepare for digestion. So if you have severe symptoms of bloating and indigestion, this can be a great way to start. But if you're taking Digestive Enzyme Pro long term, then you may want to consider taking it after the meal. And here's why. When you take it after the meal, you're not going to suppress your natural enzyme production. You're allowing your body to produce whatever enzymes it's capable of producing, and then you're just helping it out at the end. And personally, this is how I take it. So Digestive Enzyme Pro is one of the most effective treatments that I offer my patients, and it can make a tremendous difference in bloating, indigestion, as well as bowel habits. Next, we have betaine and pepsin. So betaine is hydrochloric acid, and pepsin is the enzyme to digest proteins. So here are some clues that you may have low stomach acid. If you notice a lot of belching and bloating after meals, or if you feel full for hours after the meal, or if you get phlegm in your throat from the undigested food, or if you notice undigested food fragments in your stool. These are all clues that you may have low stomach acid. So you can start by taking 1 capsule after the meal. And if you have no burning, this means you need it and you're not making enough stomach acid on your own. But if you do experience burning, this means you don't need it and you're already making enough stomach acid. Now, if you still feel bloated, the dose can be increased to 2 capsules. You can also try taking it immediately before the meal or at the start of the meal. But if you take it before the meal, there's a higher chance of experiencing burning. So that's why I usually recommend taking it after the meal. Also, by taking it after the meal, you're allowing your stomach to first produce whatever stomach acid it's capable of producing, and then you're just helping it out and adding to it at the end. Now, if you experience any burning, don't be alarmed. You can easily resolve this by eating a little bit more food, drinking some water, or you can take a 1/4 teaspoon of baking soda and put that in a glass of water and drink that to neutralize the extra acid. Both Digestive Enzyme Pro and betaine and pepsin significantly improve food toleration. So if you're reacting and hypersensitive to foods due to gut microbiome issues like SIBO, they can make a big difference. Some people do benefit from taking both and take 2 capsules each after every meal. Another helpful tip is that you can take additional doses in between meals if you still feel very excessively full or bloated, or if you notice phlegm in your throat from silent reflux. For example, if you had a pretty heavy lunch and an hour or two later you still feel very full and bloated, then you can go ahead and take an additional capsule of Digestive Enzyme Pro and Betaine and Pepsin to help improve digestion. Let me give you another example. If you wake up first thing in the morning, but you still feel like your dinner from the night before hasn't fully digested, and you're noticing phlegm in your throat from silent reflux, then you can go ahead and take a capsule of Digestive Enzyme Pro and Betaine and Pepsin to help clean up your intestines. Also, I recommend that you swallow your Digestive Enzyme Pro and Betaine and Pepsin with a small amount of water. So you want to avoid drinking a big glass of water because that's going to just dilute your natural enzymes and stomach acid. Now, what if you normally take a bunch of supplements after your meal, which requires drinking a lot of water? Well, then I recommend try to wait at least 30 minutes to an hour after your meal before you take your supplements. That way you're not diluting your natural enzymes and acid with a lot of water. Now let me give you a couple other tips that can also help your digestion. Natural ways to acidify your stomach include lemon juice and vinegars, like apple cider vinegar diluted with water. Fruits also have natural enzymes. Pineapple has bromelain and papaya has papain. And any fruit that's tart can help in digestion. For example, you might find it helpful to have a few berries at the end of a meal. And here's another tip. It's best to eat when you're really hungry, because when you're truly hungry, your stomach makes more acid and your pancreas makes more enzymes. You also want to practice mindful eating, so you really want to slow down and enjoy your food. Remember, you start making amylase in your saliva. So you want to eat slowly, chew carefully, and savor every bite. And don't eat when you're stressed. This will help you to eat less and to avoid overeating. Because if you overeat, this is going to overwhelm your system, and you may not have enough stomach acid and digestive enzymes to break down that amount of food. And this can lead to a lot of indigestion, bloating, and non-acid reflux. So why is mindful and relaxed eating so important? Well, that's because the vagus nerve plays a big role in all phases of digestion, starting with the cephalic phase in your mouth, followed by the gastric phase in your stomach, and then the intestinal phase. Remember, the vagus nerve tells the parietal cells in your stomach to make hydrochloric acid, it tells your pancreas to produce enzymes, and it tells your gallbladder to contract and release bile into the intestines. Finally, the vagus nerve also strongly influences motility in the gut by promoting the migrating motor complex, which are the waves of peristalsis in your intestines. Thanks so much for watching, everyone. Now, if you have a lot of bloating and suspect you might have SIBO, be sure to check out this video next to learn how to overcome your symptoms using my natural herbal protocol.